Hello, everyone. Thank you for joining. We'll give it just a couple more seconds and let people come online. All right. Thank you for joining our webinar today. How healthy is your current consent process? And we'll examine patient, staff, and financial impacts. A couple quick housekeeping items before we get started. This webinar will be recorded and distributed via email to everyone who registered. All participants will be muted to minimize disruptions during the presentation. Please join in the conversation though using GoToWebinar questions. The Q&A portion is at the end, but feel free to submit your questions throughout the discussion. All right, let's get started. My name's Desiree Paoli. I'm the Director of Product Marketing here at Interlace Health, where I work with our customers to help them solve some of their common workflow challenges. And I'm excited to have you all here today. High level, what we're going to go over, how paper-based consents can undermine patient experience, why staff prefer digital consenting, and the budgetary impacts of paper-based consenting. But before we jump in, I want to kick off a poll, and you'll see this pop up on your screen. And if you can just take a second to answer the question, do you use eConsents at your organization today? And what I mean by that is, are you using fully digital consents? So not collecting a signature on paper and then scanning it into your EHR, but fully digitized consents. So that signature is being captured digitally, either with a Topaz device or on a touch screen with your finger. You know, that form never really touches paper. So it looks like we've got a good percentage voted. If you still haven't, I'll leave it open for just a couple more seconds. I appreciate you taking the time to do that. It looks like the vast majority, over 70%, are not using eConsent in their organization today. So I hope that this presentation is going to be helpful for you. So I'm going to close out that poll. So you now should be seeing my slides again. And I want to just jump right into another question you may have never considered before. How healthy is your consent process? You might not think of your organization's various processes and workflows as having their own health, but they actually do. In most businesses, healthy processes add value to the completion of a product or service. In healthcare, that value directly contributes to the experience and the health of the patient. So unhealthy processes can actually reduce the overall value of your services and the care that you provide to your patients and impact their overall experience and satisfaction. So how does an unhealthy consent process impact patients, your staff, and your bottom line? That's what we're going to dig into today. Paper is one of the biggest contributors to an unhealthy process in healthcare. So much of the rest of the interactions we have day to day has gone digital in our lives, but healthcare has been unfortunately stuck with paper. A couple examples here on the screen are that 75% of hospitals still use paper to collect critical informed consents. And 95% of patients have frustratingly had to provide their same demographic information over and over again on paper-based forms, even though it lives somewhere in the EHR already. So how does this lead to poor patient care and patient satisfaction? Let's look at this from the perspective of informed consent for surgical procedures. So we know that 67% of consents are missing on the day of surgery. In some cases, they can quickly reconsent on paper and go on with the procedure. But in many, 14% in fact, the procedures are delayed or rescheduled. So these unhealthy paper-based consent processes can hurt your bottom line. Research has found that consent delays cost the average 500-bed hospital over $265,000 annually, and a larger hospital can experience losses in excess of $2 million. That's not surprising when you consider that just 1 minute of operating room time costs an average of $36 to $37. So if you multiply that figure by the length and frequency of delays, and then that total number of procedures your hospital performs each year, and that cost of surgical delays turns into a significant hit on your financial performance. So one example, at $36 a minute, a single 1 hour delay costs over $2,000. So a hospital with just one such delay every day would lose more than $15,000 a week. Really starts to add up quick. But let's look at that same scenario from the patient perspective. What happens when a consent form for a procedure goes missing in a state that requires consent be provided at least 24 hours prior, if not longer, to the procedure? The patient may have taken time off work, fasted for the better part of a day, and made several other arrangements, and now their procedure has been postponed because of a missing form. That is infuriating to the patient, but unfortunately not all that rare. So I've only outlined a couple of ways that paper creates unhealthy processes and negative patient experiences related to consenting, but I'm sure you can imagine how this also impacts surgical staff, schedulers, compliance teams, and many others throughout the hospital as well. So let's talk about those impacts on staff. Unhealthy staff workflows is another huge factor on overall patient experience and the health of your consenting process. Wakefield Research recently released the Internet of Healthcare report, and it uncovered how patients, healthcare professionals, and administrative staff, and even executives view the healthcare patient and employee experience. Half of healthcare administrative staff report seeing an increase in the amount of manual data entry just in the past 12 months, as if we're actually going backwards, away from digital technologies. In fact, 54% of staff reported using paper-based forms at least once a day, but most were far more often than that. And nurses have been shown to spend 25% of their time just on paperwork. That is a huge part of their daily schedule. So it's really no surprise then that 92% of clinicians think that administrative work is a major contributor to the healthcare worker burnout. It's clear that paper leads to unhealthy staff workflows and mentally drained staff. Many of our clients have recognized this burden on staff, especially now that so many healthcare workers are leaving their field, and they've turned to a digital process to carry some of the burden for their staff who remain. So I want to share a few of those customer examples with you. These are real examples from customers we've worked with over the last 12 to 18 months. First, we have an IT infrastructure coordinator at a mid-sized health system. She wanted to improve the accuracy of their consent forms, reduce errors, and improve their audit trail. They were pre-printing consents for surgeries, blood use, and CT scans. And the nurses were often too busy to add the time and date along with the signature. Sometimes those consents were even missing signatures. When it came time to scan the consent into the patient chart, the manual process occasionally resulted in errors. However, with electronic informed consent, they were able to have the time and date stamp automatically appear after the signature was applied. They could make those signature fields required to avoid missing any crucial signatures. And after the form was signed, it automatically archived into the correct patient chart. At a large university medical center, the director of HIM was experiencing some similar issues. He wanted to standardize their consent process across all of their locations and add in more automation to make it easier for the staff. Because their various processes were on paper, there really was no integration with their EHR. So this occasionally caused them to fail to meet those regulatory guidelines that they're required to. However, using electronic consents, they can be sure that the care team is always using the most up-to-date version of their form at every single one of their locations. And they now experience seamless integration with the EHR because the data pulls out of there and auto-populates on the form, and then it auto-archives back into the EHR. And they also have that added benefit of getting rid of paper. And our final example was an organization looking to auto-populate patient information, so they didn't have to collect it manually every single time on paper. Innovation really is key in healthcare, and with electronic consents, the innovation lead at this large health system was able to save time and reduce errors by having patient-specific information automatically populate onto those consent forms through seamless integration with the EHR before the form even went to the patient. So I know that was a quick overview, but I'm going to dig into some of these benefits in more detail. But I want to pause and do one more poll question. So you'll see this pop up on the screen. Which of these three examples of the needs that our clients wanted to address can you relate to the most? Reduce errors and improve audit trail, standardize, automate, and streamline, auto-populate information on those forms, or we're speaking your language and all of the above. Or maybe there's none in this case. So I'm seeing about 40% have voted. So if you haven't had a chance, just quickly click the answer on the screen that is most applicable to you. And we're approaching 60%, so just a few more seconds here. All right, it looks like the majority of you are clearly saying, all of the above. So we feel you, feel your pain, and I hope we can offer a few solutions here today. So I'm going to close out that poll. And we are going to jump to why e-consent is better. A healthy digital-based consenting process really makes it easier for patients to complete the necessary forms and much more difficult for staff to misplace those. It just makes your patient's experience healthier and your staff experience healthier. Processes built around e-consent can reduce a great deal of that burnout potential because your staff will no longer have to waste time searching through in-baskets or folders for forms. All they need to do is scan a patient's wristband to ensure the correct consent form is generated, and the patient records are incredibly easy to archive and retrieve without additional manual entries, scanning, or indexing. And that makes your staff's experience healthier. But why is e-consent so important today? Patient expectations have really changed over the last couple years. They want a better consumer experience, and they have for a while. In fact, in 2019, half of all patients surveyed said they would switch providers entirely just for a better digital experience. So that includes many of the capabilities that are listed here when they're talking about digital experience. Online scheduling capabilities, remote registration, texting to communicate or to schedule or check in, that digital check-in option, patient portal integrations, and even payment processing, all from the touch of their phone. A key factor that will ensure success with all of these new digital options and really round out those new processes to finally get rid of that remaining paper trail is e-consent. But it's commonly overlooked and underutilized technology in many healthcare organizations today. So I want to dig into two specific examples that show just how dramatically improved the process can be when it goes digital. My first example is with pulmonology inpatients. So what's going on in the pulmonology department at this large health system? With several large hospitals and clinics throughout the Northeast, pulmonology inpatients represent 30% of overall hospital discharges, which amounts to over 94,000 patients per year. Each patient signs an average of 2 to 3 consents during their stay that are 2 pages each. So that quickly adds up to 472,000 pieces of paper annually and over 11,000 hours of nurse time spent pushing paperwork through the system. Additionally, given the various workflows across hospitals and the involvement of many other departments with the patient care, it can take up to 72 hours before the executed consent is accessible in the EHR. The patient volume in this service line is really critical for the health system, and having a streamlined forms process is essential for managing these patients and their data effectively. But we know that paper processes are prone to manual entry errors, lost forms, and delays. With this many staff hours involved, burnout from paperwork is also a concern, as we've discussed already today. So let's look at how a digital workflow using e-consent in this pulmonology department can improve process and create consistent workflows throughout the health system. So first, the pulmonologist treating the patient places orders for a test in the EHR. An HL7 message pushes into our solution, designating the forms that are needed for the patient to have this test. When the nurse next enters the patient room, they use their tablet to scan the patient's wristband, which then pulls up the patient and the forms that they need to sign. All the patient information is auto-populated onto the form, so they can discuss the test, and then the patient can quickly sign with their finger on the screen. The physician receives notification that the form is ready for countersigning, if that's necessary at their organization, which they complete on their computer. Once they finish, the form is instantly archived. Anyone in the care team or throughout the hospital can access the form. The pulmonology department and adjacent care teams like respiratory now have a streamlined workflow for managing these patient forms. So how do we measure the value? First, you have staff time saved from scanning and indexing those 472,000 pieces of paper we talked about, and over 11,000 hours of nurse time processing that paper through the system. That has been eliminated. You have instant archival of information. The entire organization can go in and verify that those forms are completed accurately without all of those hours of time pushing them through. Additional value with this new process, there are no longer any missing forms pre or post-surgery, which reduces significant liability. You know that you have the most up-to-date consent each time and that it's the right consent for that patient. Because the patient's information is auto-populated, there's little room for manual error, so you can rest easy knowing that the form is accurate, processed, and archived correctly, which improves compliance and reduces risk of HIPAA violations with forms laying around. This pulmonology department has freed up significant time and resources to focus on patient care and eliminated any of those forms worries. The second example is cardiology and cardiothoracic surgery. So what's going on in this heart institute at a regional pediatric hospital? Their surgery department is the only option for pediatric patients in the region, so they have a high volume of pediatric surgeries and catheterizations, over 1,500 a year. They're required to collect informed consent the day of surgery or the day of the procedure, and so the nurses are responsible for printing the necessary forms and putting them into the chart. They're later scanned, filed, and shredded. So this amounts to about 7,500 pieces of paper and over 1,000 hours of cardiac nurse time to process these consents. With the implementation of eConsent for these surgical informed consents, the entire process is condensed. During pre-op, the nurse launches the consent forms on either computer or tablet, and the patient and provider information related to the procedure is also automatically populated. The physician comes in and reviews the consent with the patient guardian, and both sign right then using the touchscreen. The time and date is applied electronically and locked. And then the form cannot have any future edits, and it's instantly archived into the EHR. Copies can later be emailed to the patient, and then during timeout, the physician confirms consent was collected and they can begin the procedure. There is no paper trail related to the consenting of these patients. Those 1,000 hours of cardiac nurse time are repurposed for patient care. So what's some additional value they can measure? We know that information can change on consent forms occasionally, and using a digital solution allows you to ensure you only have that most current form like we've talked about. There's no scrambling to prepare and print the consent during pre-op, and it's easier to complete for the physician because all of the risks and benefits and specifics that they like to go over as part of the consent are automatically entered into the form for them. Workflows for consenting are streamlined for the surgery team, in the cath lab, and even in the CICU if patients need additional tests or procedures during their stay. So this increases efficiency across the department, improving staff satisfaction related to consenting and creating a digital process for the patient that gives them more time to ask questions and discuss the procedure as opposed to filling out tedious information on a paper form. So quite a few examples there, but now I want to dig in to beyond that implementation. So we've talked about, existing paper-based process versus going digital and how does that vary? But now I want to share a couple of customers who've experienced our solutions for a few years and the benefits that they've seen. Singing River Health is one of our clients who was able to utilize our consent during the chaos of 2020. They have shared that some of their biggest benefits were the ability to easily automate and digitize the process of informed consent, customize consent forms, and experience seamless integration with their EHR Epic. The ability to complete forms at the bedside on a tablet was essential and a major game changer for their staff. With the end users being namely clinicians, usability and adoption were key factors in their choice to partner with Interlace Health. After using the solution, their providers actually became their #1 fans and key advocates for the new process, which we often know that getting those physicians on board for change is sometimes the biggest hurdle. Since going live with Interlace Health, Singing River reports an average of 10,000 digital forms completed annually and estimates a time savings of over 500 hours that were previously spent prepping and scanning informed consent forms. So a lot of value in just a short amount of time for Singing River. Up next is Steward Health. They're using e-signature at registration across many facilities. They did an analysis of their HIM team and found that a seasoned HIM tech can prep, scan, and index 1,900 completed patient forms per day, and they were really doing that many. This amounted to over 468,000 forms per year for just one FTE. They implemented our e-signature registration solution in their West facilities, and 5.8 million forms pages have now been signed digitally. That is 12.5 FTEs they have saved by no longer processing all that paper through the system. And I was talking with the HIM director recently, and she told me that across all Steward facilities who've implemented Interlace Health solutions, they will actually save a total of 50 FTEs. With staff shortages what they are today, this is a tremendous relief on their resources, as you can imagine. So let's dig into the budgetary impacts. So how do our customers like Singing River and Steward Health measure the overall ROI after implementing our digital e-consent solutions? Interlace Health has an ROI tool for measuring success. One example is our informed consent ROI calculator, which is based on 3 metrics: impact of surgical delays, the financial aspects associated with paper, and the resource burden associated with that paper process. And here you're looking at a bunch of statistics that we've talked about throughout this presentation today that we use as the basis for each category. These numbers help us determine current costs from using paper and then show you what you would save by going digital. So this is an ROI we calculated for a mid-sized acute care community hospital by plugging in their specific numbers using the stats on the previous slides and some discussions with them about their process. Based on their surgery numbers, the cost of lost surgeries due to paper-based delays alone came out to $192,000 a year. Based on the number of consent pages that they printed each year, their printing cost was calculated at over $31,000. And then based on the hours that they spent managing the consents, processing those through the system, and using the average hourly wage of their staff, there was a savings of $485,000 from reducing that paperwork burden. Not to mention, we've talked about staff shortages and just having time for staff to do other things and not carry the burden of doing 2 to 3 people's jobs is tremendous. So this organization saw an overall ROI of over $710,000 in estimated annual savings by going digital. So final poll question. Because I've shared a lot of numbers here, is would you like to meet with one of our reps and learn more about our eConsent solution and get a free ROI assessment for your organization? So you can just quickly check yes, no, maybe in the future. Got about 30% who have voted, so I'm just going to leave it open for a few more seconds while you take the time to answer. Got about 54%. So quick click on the screen and just check your answer. All right, hit about 60%. So I thank you all for taking the time to do that. I will close that out. All right, as we're rounding out this 30-minute webinar, I wanted to just reiterate some key takeaways today. The health system leaders that we know take these challenges that we've discussed today to heart. They know how dedicated healthcare workers are, and they understand the strain that staff shortages cause for those who remain on the job. Many CIOs and healthcare IT leaders have told us that their top priority is to find ways to reduce these strains with improved processes. And rightly so, because the impact spanned beyond staff burnout and patient satisfaction. Tedious paper-based tasks drain resources unnecessarily. Document errors and missing data cause compliance headaches at a minimum and lost revenue on the other end of the spectrum. And subpar workflows can create critical delays in care, such as surgical delays or reschedules when those consents go missing. Digital forms really should be #1 priority in the next year or so. And there's 3 big reasons why. You guys are experiencing critical staff shortages, and it will help with that. Staff and patients want a more digitized experience. And it's where healthcare is heading in the future with telehealth, improved patient portal access, and so many other digital resources that are becoming the norm. And then why change now? We've talked a lot about why paper-based workflows need to be eliminated. But why is the time to do that now? Really, these manual workflows are not sustainable, especially with the staff shortages. And as we've talked about, the burden of all this paper is having a negative impact on both your staff, your organizational processes, and downstream your patient experience. Digital forms are really that first step in rounding out your processes that you've already been working so hard to get digital and getting rid of those final paper trails that exist throughout the departments. And quality patient care is really on the line. We've heard a lot of staff say that these burdens of paperwork and administrative tasks are taking away from their ability to provide optimal patient care. So you can free up time to do that. So how can Interlace Health help? You can visit our website, interlacehealth.com/contact. If you'd like a customized demo that meets your organization's needs, we can work with you to create that ROI analysis for your organization so you can see the time and money that can be saved by transitioning to eConsent. We have a live demo of our informed consent where our team will be walking through what it really looks like for a patient and a staff to experience that digital consent. That's happening on July 6th at 11 a.m. Central. And you can go to interlacehealth.com/resources to register for that demo. And then we have a customer summit. For those of you on the line who are current customers of ours with a variety of solutions, you can come to our customer summit in Orlando, September 25th and through 27th this year, and learn more about all of our solutions and offerings. So we're going to take a moment here to open it up for Q&A. And a quick reminder, when we close out this session, you'll see a brief survey pop up on your screen. It should take you less than a minute, but it really helps us in the process. And before I get to questions here, I see that the HIM director that I referenced for Steward Health was on the call today, and she said eConsent is on her radar and she hopes to implement one day soon. She's using e-signature at registration today, and like I said, seeing a lot of value. So hi, Brandy, thanks for joining. All right, next, another question is, process of consent should be written, some verbal, such as answering patient questions, and some visual. So how can those avenues be addressed in eConsent? So in most of these situations that I outlined today, the patient is in person in the office, still going through the consent with either the nurse, if that's the scenario, or we know most times that's the physician that's going through the consent with them. So the actual process of how the physician talks to the patient about the procedure, answers their questions, how much time they spend going through that, none of that really changes. What just changes is at the end, instead of putting pen to paper, we're putting finger to tablet or Topaz pen to the Topaz screen to sign that consent form. And it actually just frees up a little bit of time because the patient isn't having to manually enter that information. The physician isn't having to sort of add in any of that information that they like to include on their consents because we've already worked with them to build those all in. And our digital forms even have the availability to do annotations on different illustrations that you might want to use for your procedure to sort of describe what might happen during that process. And you can pause at any point and take the opportunity to give them extra education, whether that's watching a video or going through pamphlets or just talking through with the physician. So like I said, ideally, it doesn't change your process at all as far as that verbal piece goes. It just changes how that form is collected and automatically archived. I see someone that's asking about a copy of the slide deck. We will get that to you via email so that you can share that out afterwards. Thanks for that question. And then another question is, do you have to use a mobile device to collect signatures with your solution? No, you absolutely do not. We are really device agnostic. It's a browser-based solution, so you can use a laptop that has a touch screen. You can use a Topaz device connected to a computer with an extra monitor that the patient's able to review it. There are really a multitude of options that you can use based on what works best for the workflow of your organization. Thank you for that question. I think we've got time for maybe one more question. How many signatures can you capture? Well, that's a good question. It's really unlimited. So let's say there's a guardian that needs to also sign. You know, maybe you have an 18-year-old patient who's going to sign, but their guardian's signing as well. You need the physician to sign. Perhaps you have a translator who's signing as well, who's representing the patient. You need to get your anesthesiologist to sign off as well. Maybe you've got information in your particular consent that speaks to anesthesiology. You can really build out as many signatures as you want into your forms, and we help you do that. All right, oh, one more question popped up, so we'll answer one final question. We'll jump off here of who designs the forms that capture these signatures, Interlace Health or the hospital team? That's a really great question. I didn't dig into that a ton today, but if you join the demo on July 6th, you can learn more about that. But basically, however you'd like to do it. Initially, we work with you to convert all of your paper-based forms to digital so that you're ready to go live once we implement the solution. And then beyond there, we can do it either way. If you have the resources to build those forms, we will show you how to do that and give you access to our forms designer. If you need us to do that, we have staff available as well who can help you manage your forms design moving forward and really manage your system for any changes that happen. So a lot of flexibility there based on your particular needs. So we went just a minute or two over, so I apologize for that, but I thank you so much for joining today again, and this recording will be sent out to everybody who registered. And please reach out, interlacehealth.com/contact if you have any additional questions for us. Thanks again and have a great day.